Hi, Dr. Hamad from the Neuromedical Institute and All Med Medical Center. Today we're going to talk about a very important topic that many people suffer from, including myself, which is migraine headaches. The reason I want to talk about it because it really inflicts a lot of people, affects their lives, and a lot of times they go without diagnosis. So I wanted to shed the light on migraine headaches to educate people about it and to better treat it. So essentially, migraine headaches affect the population between age 25 to 39. It affects more in women than men because it's linked to hormonal changes. It affects about 12% of the population. The pathophysiology behind migraine headaches is very complex. A lot of theories have been proposed, but the biggest theory that has been shown to be true is cortical depression, which meaning is that there are abnormalities within the nervous system, within the nerve cells in the brain, that they produce chemicals that cause inflammation of the nerve cells, inflammation of the blood vessels, dilatation of the blood vessels, and therefore you have the pulsating nature of the headache. It is a lot more complex than what I'm explaining, but I'm trying to simplify it. There's also a phenomenon called sensitization. These chemicals will sensitize the brain cells, resulting into having the sensitivity to light, the sensitivity to touch, and even the sensitivity to your environment. There are different types of migraines. I don't want to go into the details of the rare and complex types of migraines, but in general, the two main types of migraines are common migraine and classic migraine. Classic migraine are those migraines that are preceded by an aura. An aura essentially is an event that precedes the headache. The most common type of aura are visual changes, presenting with zigzag lines in the visual field, flashes of light in the visual field, possible blurred vision. And of course, there are other types of aura, including sensory auras, where the patient might present with numbness, tingling sensation. There are language auras presenting with a language deficit, and there are the rare motor auras where they present with the motor deficit prior to the headache. Of course, there are different types of also migraines that I don't want to get into, usually diagnosed by a specialist. Now, in treating migraines, there are two different ways to treat them. There are the first one is abortive therapy, which is a medication that you take to stop the headache. And there is a prophylactic therapy, which is a medication that you take to prevent the headache. Before we get into the treatments, I want to talk about triggers. Triggers for migraines are extremely important. Because if you avoid and take care of the trigger, then the migraine gets better by itself. And triggers are different from one person to another. They can be lack of sleep, can be stress, can be specific food, specific spices, chocolate, wines, or even specific smells. So I always tell my patients, please try to pay attention to your triggers, identify them. If you take care of them or avoid them, then your migraines get better by themselves or significantly improve. Always look back an hour or 2 hours before your migraine started and try to figure out what happened during those 2 hours that resulted into your migraine. And of course, if this happens all the time, then it's easier to identify your trigger. For abortive therapy, it's a medication that you take to stop the migraine. There are different types of medications that you can take. If your migraine are easy, you can take what we call them the NSAIDs, ibuprofen, naproxen. Naproxen is pretty good. diclofenac, any of those medications can stop the migraine. But the specific medications that you take are called the triptans. Sumatriptan or Maxalt, Imitrex, those medications can be are specific for migraines. And of course, there are newer medications that you can take. Sometimes if you combine one or two medications, that might be very helpful. There are different routes of medications. It can be injectable, or it can be tablets, depending, or it can be nasal spray, depending on your migraine and what works for you. Your physician will determine what's best for your migraines. The key with abortive therapy that I wanted to emphasize is to take the medication at the onset of the migraine, or if you have an aura, or you have ways to predict or to know that your migraine is coming, is to take the medication before your headaches start. We talked about the sensitization, and we talk about the cortical depression. If we can take the medication and stop this early on, then you control your migraine attack very quickly. However, if you wait until this phenomena is complete, then it is a lot more difficult to control your migraine, and the attack can last for hours, if not for days and weeks. I always say, the worst migraine is the migraine that wakes you up in the middle of the night, or you wake up in the morning with it, because it's completed, or the phenomena is complete, and therefore this migraine will last for hours, if not days. So I always tell my patients, do not leave the house without you having your medication with you, because the minute you feel like your migraine is going to start, take that medication. And that is the only pain ever that I always say, don't wait until it gets worse. Take the medications right away. Now, for prophylactic therapy, it's a medication that you take on a daily basis so you can prevent the migraine. And there are a lot of those medications. Topamax is one of them. Antidepressants is others. Anti-seizure medications are another medication. Or blood pressure medication, another medication. So your physician will decide which medication might work better for you. And of course, you can go to intervention, and that can include Botox injection, can include nerve blocks, occipital nerve blocks, stellate nerve blocks, phenylpalatine nerve blocks. There are a lot of different interventions that your physician can recommend or can perform to help with your migraine. So there are other things that you might do. Hydration is it helps a lot. I always tell my patients with migraines to drink at least 2 to 4 liters of water, of course, if it's not contraindicated. Magnesium can be of some help. And of course, the most important thing is to avoid triggers. There are other things that can be tried, like electromagnetic field therapy and other devices, but always consult with your physician to know better about alternative options to treat migraine. But the most important thing, again, to get to know your migraines, get to know your triggers, avoid them. If you avoid them, you better treat your migraines. Please, if you have any questions about things that I discussed or have not spoken about, so please don't hesitate to leave any comments, and I will respond to them personally. And thank you very much.